My name is Amir Zakhary, and I'm a student at St. Louis University. I plan to attend medical school after I graduate, and I've been a volunteer on the 2 West floor at SSM St. Mary's in St. Louis for the last year and a half. I think my experiences as a St. Mary's volunteer are best represented by the concept of pure love. I'm a Coptic Orthodox Christian, and my faith plays a monumental part in how I behave at St. Mary's. Coptic Christianity was founded in Egypt by the Apostle St. Mark, and the church now has over 18 million followers worldwide. The Coptic Church uses a different calendar than the Catholic Church, but observes the same sacraments and holidays. Each year during Holy Week, the congregation is often at church, chanting many hymns of praise. After the praises, we all sit and listen to a sermon pertaining to the events of Holy Week. This year, an elder at our church talked about a woman who had washed Christ's feet with expensive perfume and wiped his feet with her hair. This woman had given her most expensive and precious substance to the Lord physically and spiritually. In addition, anyone who smells the perfume from a distance recognizes that it comes not from her, but from Christ. Thus, this woman gave God all the glory and asked for absolutely nothing in return. My friends, this is the purest love, to give your best and to ask for no glory in return. This is what I think of when I volunteer. I walk onto the floor at the 2 West nursing station, and I see nurses and care partners who have already been working for 9 hours. They need this pure love. I see the hardworking folks from housekeeping, food services, and telemetry. They need this pure love. When I walk into each patient's room who has spent 1, 2, or 3 weeks in the hospital without a visitor, I just always remember they also need this pure love, perhaps most of all. However, what does this pure love look like? Sure, we have seen this pure love in the Bible with Jesus Christ, but what does it look like in 2016? I remember once I scrubbed into a patient's room to help tidy up a bit. The patient was thrilled to see me from the moment I entered into the room. The patient asked me to get his finished dinner tray out of the room. I gladly accepted, took the tray out of the room, and placed it into the proper container. When I came back, the patient asked for help turning on the TV and turning off the lights. Again, I helped the patient. He then asked me to help him dial a family member's phone number for him. And again, I dialed the phone number and handed him the phone. The patient told me to wait while he spoke to his family member. Curious, I waited in the room, and the patient then told his family member that I was taking great care of him and helping him with every need. The patient handed me the phone, saying that his daughter wanted to thank me. In a short 10 seconds, his daughter thanked me in abundance for the service toward her father. I had not thought once about helping her father in order to receive acclamation, but her grateful thanks made me feel like I had truly made a difference that day. I treated the patient with pure love and received pure love back in return. However, even in cases where a patient does not treat me with the same love, that is fine. The greater the blessing, because greater the pure love. I remember another time where the reward was greater, but the path was more difficult. A patient had asked me for a new gown, so I proceeded to get the gown and promptly returned to the patient. The patient then asked me to take some cash and buy him some food from the downstairs cafeteria. I did not feel comfortable taking money from a patient, so I instead asked the patient to wait a moment until a staff member could come and assist him. The patient agreed and waited patiently. I told the people at the nurse's station the situation, and the patient's nurse and care partner said they were on their way to the patient momentarily. After an hour had passed, the patient came out of his room, saw me, and was extremely frustrated. Apparently, the nursing staff had been pulled away to attend an urgent situation and had not yet given him the assistance he had requested. He yelled at me, calling me irresponsible and telling me that I would never make it in life because I did not have what it takes. My heart shattered at the patient's comments. I waited another 2 hours, praying, and decided to go to the patient's room. I knelt before him and apologized completely for what had happened. In return, the patient apologized for yelling at me. He told me that he had been frustrated because of a previous altercation with a family member and was struggling with the stress and anxiety of being at the hospital. We then spent the next 20 minutes getting to know each other, and our relationship concluded with a nice cold Sprite on me. I left the hospital changed that day. The pure love was shown to the patient and was also shown to me that day. I offer both stories because together they demonstrate what it means to be a volunteer. On most days, people are extremely grateful for your efforts, your sentiments, and your deeds. However, there will always be times when your faith is tested, your limits are pushed, and your smile crumbles. And yet the pure love that was shown to Christ prevails in all situations. I volunteer to extend that love to both the patient that thanks me and the patient that does not thank me. I volunteer for the staff member who has just had a child or is fighting to keep 2 jobs. I volunteer for the director who shows me the power and the importance of volunteering and who treats every person that comes his way as the image of God. The purest love that I've experienced has not been the love that I have shown to others, yet the grace that others have shown unto me. Volunteering at St. Mary's has been one of the most meaningful and uplifting experiences of my life. I would like to thank the patients and staff at St. Mary's, and especially my family of nurses, care partners, and housekeeping at 2 West, and especially Mr. Thomas Lavanos, Volunteer Service Directors at St. Mary's, for teaching me how to be the best volunteer I can be, and for making it possible for me to be here to speak before you today. Thank you all for your time, and God bless you all.